Anyhow, good afternoon. Again, my name is Linda H. Scruggs. I am excited to be here with you today. I have the worst assignment of the day, though, because it's between you and you leaving and going to do whatever it is you need to do. The other hard thing about today is I was charged, and someone used my coin. I think it may have been Kathleen. I think me and Kathleen is having this new connection. Talked about connecting the dots. So when I was called to come and talk about connecting the dots around systemic approaches and how does that fit and shape in a community approach. And also, one of the things I love about this concept is I get to be the lived and living person who also benefits from this systemic approach. I'll share with you briefly, I am a woman diagnosed with HIV. I am a woman who decided in April the 12th, 1988, to stop using substances. Cocaine was my best friend and my favorite girl. I didn't know and had never heard there was a choice that I could have a harm reduction space. So at that time, I experienced total abstinence. Once I discovered there was other options, I kind of figured we was kind of comfortable, and I already gave her our divorce papers, so I chose not to go back to her. But I made a conscious decision. I wish General was here. Even as an ordained minister in a full gospel Baptist church, I made a conscious decision to honor and respect and to hone in and help others come to a place. I think I heard you say it earlier, Adam, I think it was, that he said that I no longer use drugs to harm myself. So I love to be able to do that. I'm going to come to you on a couple perspectives, both as a person who intuitively, after her own life experiences and working in the HIV field, probably since about 4 months of my HIV diagnosis in 1990. HIV, I'm part of the generation where HIV was still a death sentence, when they literally gave me a choice and a date and year to kind of, lay down and get it together. I'm really happy. I did not sue any of those doctors. It was 3 white men who told me I would die. I didn't sue them for malpractice. I was okay for that wrong diagnosis. As a result, though, I've been able to utilize my lived and living experience and didn't know that we was doing a syndemic approach. I didn't know that, because when I started working at Johns Hopkins in the 90s, and what I see even today, community, and we acknowledged it from our Native family members here in the space, this has been happening for centuries, right? So if it's been happening for centuries, why did we just name it? Why is it the new tea of the month? Why is this flavor so good, And that is because we have to figure out how do we use it. And only if it's tea that look good and feel good can we fund it. Can we create policy around it? I don't know, it's nothing new I can tell you that I have not heard in this room. We're doing it. It has to be rooted. And Dr. Merman, he actually did my session this morning. I'm gonna ask you, in a couple of minutes, I'm gonna ask some of you. You came out with great breakouts. And all of us didn't hear that. So I'm gonna ask folks in a couple of minutes, somebody from each breakout, I wanted you to talk about, before folks leave out, what was happening there. The crew in the back gonna give me Dr. Merman's last slide. He wrapped up what I really wanted to say, so I did get permission. It's not a CDC slide, so we can use it. Talking about systemic approaches, this is the core. I love that Dr. Merman started in the morning, and I was really happy because when Eric and folks first called me, I'm like, well, what in the crackers barrel is that? Right? And we was Googling, and I've been hearing about it. I'm like, but what really is it, right? I'm so glad that I'm not just the smartest third grader in the room, that we really don't know what it is. It's constantly unfolding because it wasn't ours. It wasn't ours to name, to home, or define. It really is a living and lived experience. And whether you're the person or you're the committed ally who's living this experience along with us. So I love that. I love the concept of putting people first. Syndemic is not just meeting people where they are, it's allowing you to go into their spaces. It is, I love, I can't remember the young lady over there now, I was talking to her, and I asked her about trans women in her network, and she said, yeah, they opened the door to let me in. And it's important to understand any door will work, but we have to go to them. We have to create approaches, partnerships, and collaborations that allow us to be with community. Ribbon is an organization, and we're real intuitive, so I have some really smart people probably calling me right now, and I have my phone here for my notes. They like, why did my staff call? They know where I am. I'm an intuitive leader. I have a master's degree, but before I got a master's degree, I lived about 44 years of life before I did that. So a lot of what I talk about is based out of that intuitive space. It's made common sense to be where the issues are, not the problem, where the oppression is. We've been calling it out all day, where the systemic stigmas are. People within our communities of providers, educators, they are part of the problem. So how do we intentionally create partnerships that we can create frameworks that community can have and be well as they define what being well looks like? That's what I've been hearing today. How do we build buildings? And we have to de-silo. So I'll use HIV, is that okay? It's easy to silo HIV. It is like the monster of all monsters for most of us, anybody under the age, between the ages of, I'll say, 50, I was 17 when I first heard HIV. So if you go back 40 years ago, HIV was the monster that showed up. It was the ugliest of ugliest. And I'll be real honest and absolutely know that I was not the only homophobic family in town. And we demonize what it was, and we do not undemonize who it is as it has changed our universe. Substance use is the other thing, because it's them people, it's those people. STIs, what was you doing? Well, the question is, what wasn't you doing? I love telling people I've been raped twice. I'm a survivor of rape, but I made a conscious decision. I decided that my HIV acquisition didn't come from either one of those rapes. It probably came when I was that time in Sterling, Virginia, trying to figure out how we're going to do it on this big chandelier. Some of us don't want to tell our own truth. I am the story maker of my narrative. So creating approaches that meet me in Sterling, Virginia, this is a true story. Chandelier humongous, we had seen, what was the War of the Roses? Y'all seen the War of the Roses? Then the chandelier broke and killed them, but for some reason in my beautiful relationship with cocaine, it made me a daredevil and try to figure something out. So I tell my sons, the only way you don't get HIV is that you figure out how to get up on a chandelier. But how do we, unless we have people of lived experience that would tell you what getting high like Cootie Brown really is, that you would try to figure out how to get on a chandelier, both of you, not fall and kill yourself, but have one of those supercalifragilisticexpialidocious orgasms. How do you bring approaches to people who don't look like you, who don't sound like you, who sure don't think like you and your missionary selves? This is about going outside of your own framework and creating a new normal. Because the people we're talking about, the people we're living with, the people we're looking to serve, they're not living in our box. They don't care that it's called Syndemic anything. What they want you to do is to partner. How do you partner in a place, and I know that many of our federal partners are gone, but some of you are here, and some of them are the problem. Because as long as we're in a crab basket, as long as the organizations who are supporting community are in a deep double-barrel bushel of Maryland blue crabs, we will find hard partnerships. How can I trust you when you got my stuff? It is about de-siloing how funding relationships show up. Because it's hard. I like you. Jesse, you know that. I just saw my friend earlier. We want to do work together, but man, me and Jesse out, and I don't do tequila no more, but I'll hang out with you. But there's still something different when you're talking about becoming bed buddies when you leave cocaine at home. It's a different conversation. But that's part of this systemic approach. It is creating unusual, different partnerships with intent. So we have to be able to carve out the part of ribbon. I have to carve out ribbon. One of the systemic things that we did 2 years ago, we started sharing staff. So there was 2 other organizations that were similar to the work that we were doing, and I absolutely know what I needed. And they didn't know that they needed that till I was good at convincing them what they needed, because they had some money and I had some money, and we started sharing 2 staff persons. Now, you would never know that. Jesse and folks in the room who know me don't know that and don't know whose staff that is. It's none of their business. What happened was it meets community need. They are focused on another part of the good work that we do. And it was like, what is the relationship to get all of our needs met? Y'all like this one. It's my cake, why can't I eat it? How do you have your cake and eat it too? That's really what systemic partnerships is about. Creating frameworks that works for the community and create partnerships that lessen the burden of them accessing their needs. Their needs only can get met if they're accessible. We're not gonna go through the case story that she had to catch 4 buses. Oh, there's no buses because she's in a rural community. She had to hitchhike, or she had to get the ride with the guy who she woke up with last night. We have to do the work. It's like, well, she's not making this easier. We have to work harder. But our federal partners have to work harder in the areas that they're in to de-silo how we show up and how partnerships really can happen. I made a comment yesterday around examples of how funding can look like and be creating models of real partnerships. You know, if you're living in the we're looking at clients in the same zip code. So who's in your zip code that you know that are doing the type of work that you guys can really come together and say, oh, we can do this better if we begin to connect our own puzzles of internal. We're trying to fix outer places. We're really inside. We're short, but they have something that I need. It's my cake. I want to eat it too. And how do you do that? That's with intent. That's with talking. That's with having lunch with folks to say, we're doing something different and maybe you don't know what this is. Some of the benefits of that, you guys know the answer. It's better resource allocation. They're looking for partnerships. It's less burdens on the clients, your partners, your members. We call folks ribbon members. We don't have clients. We do both national TA, and we have 2 direct service programs. Like, how did that happen, Jesse? That happened because someone said, well, can you try this locally? The health department came to us and said, we'll give you money if you would create this. So Ribbon actually have 2 direct service programs. Like, where did that come from? That came from what they saw was we kept saying we want to partner, we want to do things. And they have funded us to create a model that we believe that Hearst is going to replicate across the Round White programs. And we still didn't do it by ourselves. We went to the church. Ribbon went to a local church and said, we want you to get funded because Ribbon don't want to be the direct funder. We want you, you're in the community. We live in a really pretty little community with the ducks and all that is. My church, the church we went to, is in the heart of the highest incident rate zip code in our county. So again, taking the service, creating a new partner. Partner had never had a relationship with the health department, and bringing that partner to identify 4 other partners to extend the services. So now they're in 5 zip codes doing this type of work. That's intentional looking, not just, it's not enough to get the data. It's not enough for us to submit reports and data to our funders. If they don't interpret the data, we have to interpret the need. And we have to create programs that do that with intent. The last thing I want to go to is support workforce and partnerships. Because I'm talking from the grassroots experience. And I know that some of y'all are not gonna like that I say this. You do it already anyway. You're gonna have to do some stuff, and you have to figure out an intentional program that you're gonna do that don't nobody pay you to do, that no one pays you to do. And I'll give you an example. If you go to our website at Ribbon, you'll see a program called Ribbons of Hope. What we determined was there were some things that in this genius mind of me, my partner, and my staff, and the thousands of people that we connect with every year, they're gonna say, can you do this? Or where do you get this done? How do we get that done? Because you are the influencers, they're asking you. And we cannot wait for the federal government. We can't wait for state government. We can't wait for the RFA. We can't wait for the NOFOs. Some stuff we're gonna have to intentionally do. So at Ribbon, we put aside what we call thought days, where we literally provide our staff comp time, right? They can earn up to 10 extra comp days a year. If they come up with something that they can do, it don't cost nothing, but it's gonna add value to the work in the community space. So that's everything. I love that we have 2 directors that's getting ready to do a series on organizational development. So organizations can come that have budgets under $500,000, community-based spaces, network-based spaces, and learn everything from fiscal management to HR and all of those things. Nobody's gonna teach them how to do that. They're better situated to do community work. HRSA, CDC, nobody's gonna give me a grant to do that, but I have brilliant staff. And it don't cost me much to get them 10 comp days, it really don't. They're gonna use their sick leave anyway. I'm just saying, am I right? You know them slick days. But what's gonna happen between October and March? I think it's 10 to 13 organizations across the country with budgets under $500,000 are gonna be better equipped to apply and get resources and deliver services. That's systemic. What happened? Because we're not saying who those organizations are. We get to then what? Create cadres of networks of them working together and teaching them how to network, how to do grants. That's like rocket science stuff. It really isn't. We do it and we're thinking it every day. Systemic approaches is going between the lines. It's common sense. We didn't have to get a PhD to figure this out. All we had to do is have what our political partners don't have, and that's a will to do well. That's a will to create change. So I leave you with one bad downside about systemic approaches. They told me I had 2 or 3 negative things. Y'all know them. But let me tell you one bad thing about systemic approaches. It's hard. It's hard. It's scary. It's risk-taking. It's like walking up to the pool. I used to be a swimmer in high school. And I think I was just telling someone about me and my husband. So me and my husband, we're 2 introverts. I'm really naturally really shy. When I leave here, I'm going straight to the Uber. No, because I had a bad experience with Uber, so I'm actually riding Lyfts. That's another story. So I was saying that we both were pretty good at risk-taking, which is not always real good in relationships, but he's a little less risky than me. Because I'm like, if I see a swimming pool and there's a diving board, that automatically tells me that somebody's engineered and this water is deep enough for me to jump off the board. And I'll go run and jump. He's looking for that long pole. He's gonna jump, but he's looking just for a little bit more safety. So whether you're jumping or you're looking for the safety, I'm not gonna downsize. He's a little delayed. But because he's about 60 pounds lighter than me, we're gonna get to the end of the pool at the same time. Did y'all get that? It's okay for you to be in different spaces. The goal is both of you are looking to get here, and you still can get here together. So as hard as this is, it's intuitively possible. Some of you are already doing it, and you have to go to another level. And you will swim by yourself until you're willing to take some of the risk. There is not enough resources, and there is no new resources. Just in all of us know they messing with our money. Our stash is disappearing, it's dwindling. So what can we do with what we have? That has to be intent. It has to be with clear intent. That's what I've been hearing today, that you're already doing it. You have partnerships, but you have soft partnerships. You look across the room to really do this, not for you and your organization. And people hate when I say this at Ribbon. Ribbon never has to be a $10 million organization. There's a lot of stress and I already don't have no hair. But we have to do what we do well. We have to learn how to honor what other people do and click my yum with their yum, and then we get what? Yum yum. Y'all like that? Yeah, they're like, some of y'all nasty. I heard that. The last thing I want to say is thank you very much, and I hope you guys have a nice day.